quick overview of the program that you're running over there in the South Side Chicago.
Our program is a federally qualified community health center located right on the outskirts of the Ott-Gill-Murray housing projects. Initially, we were founded back in 1970, and we were located right inside of one of the housing units until about 1996, when we moved to this 22,000 square foot building. So we provide primary care with internal medicine or adult medicine, OB-GYN, pediatric services, psychiatry, social work. We have WIC programs and Healthy Start programs. So we pretty much have, it's almost like a one-stop shop. Walk in and there's almost anything you get. We sign folks up for, in Illinois, we're known for our previous governor, Blagojevich, started a program called the All Kids. See a smile there. All Kids, he did something good. All Kids program. So we have staff on site who actually sign children up for that program because they're eligible up to 18 years old. We also have a school health center in Carver, located within Carver Military Academy, which is about 2 minutes away from the site. But we are a primary healthcare organization offering comprehensive healthcare, and we're within miles, I would say about 8 to 10 miles of about 3 hospitals, Metro South, Roseland Community Hospital, and Advocate Trinity Hospital.
Okay, great. Now, if you can tell me what, in your estimation, is the importance of public housing primary care programs in not only your community, but in communities in general?
Gosh, I think without the public housing primary care program, a lot of residents living within public housing would go without the necessary, basic health care needs. Our health center particularly, and like I'm sure many other health centers, serve a population, indigent population within that public housing that has a lot of barriers. Particularly in our community, I would say barriers to transportation. We're in a closed community, blocked off, I would say, by railroad tracks, interstates, and there's limited public transportation, and a lot of the residents really don't drive. And we serve a population of mainly women and children, and these women have large families. I would say between some of them 4 to 8, 9 children. And imagine walking 17 blocks, because our communities consist of 17 blocks. Imagine walking 17 blocks to the health center. Imagine inclement weather. So I think without our program within the community, that those necessary healthcare needs and social service needs, they would not have access to.
If you can, as to the best of your ability, can you share maybe 1 or 2 positive success or impact stories that you've had on the community? And if you can't do specific, maybe just general.
Specific. Gosh, I would say every day we make positive impacts. So to say specific, gosh, it's really hard because we get stories, at least every couple of weeks we hear about stories with people who had that, particularly, now we have newer residents moving into the community because like throughout a lot of the larger cities, there's gentrifications, people moving in and out of communities. And I think we have newer residents moving in. And some of them have not had health care based on where they've lived before, or health care within this close proximity to where they live. And health care, I'd say, how should I say this? Primary care provider within close proximity, or a health care facility that offers not only health care but dental care as well. So I think we get stories of patients coming in saying, I'm so grateful for this because without this, we have an asthma program. We had a story the other day with an asthmatic, because the hospitals, although it's within about 10 miles from our health center, it's still, transportation is hard. Some of them, they're not thinking of immediately calling an ambulance. So they run into our front doors. So just last week we had an asthmatic, and one of the doctors, before I left the health center Tuesday, she was telling me this person walked in and the breathing they're about to go into a cardiac arrest because it wasn't the normal, it was just those quick breaths of air. And she said they came in, we had the necessary emergency equipment and the staff on site to deal with that situation right away. That could turn out to be really, really bad. That patient could have died if they'd waited for an ambulance, and if we weren't located right there with the trained staff to deal with that issue. They later on called an ambulance, but we were right there to stabilize the patient.
Isn't it fair to say that having this kind of opportunity for people to get health care in close proximity to their homes actually saves money in the long run, because a lot of them would end up not going until into an acute situation? Is that fair to say?
Absolutely. And although we're located there, we find that a lot of the patients, we have a high no-show rate. Some days it's up to 45%. So it saves money in that we deal with so it's called special population, that their emergency become your emergency. So they walk in last minute when the need is so urgent, just like that asthmatic. That could have been, in many situations, could have been shifted right away to the emergency room, or it could have been more serious. But with us being right there to take care of their primary need, to really catch a lot of health issues before it becomes more serious, I think that saves a lot of money to taxpayers. Hospitals are really glad. Hospitals in Chicago are working closer now with community health centers. As a matter of fact, a lot of us on the south side of Chicago have collaborated with University of Chicago, Providence Hospital, the Cook County hospitals, to really provide better outpatient care for these patients and to help keep them out of the emergency room. That's our biggest push right now in Chicago.
Great. Any other partnerships and collaborations that you know of that would also help you to achieve your goals?
Health centers, because it's a lot of us in Chicago and we're within closer proximities, so we do have collaborative. I think housing in Chicago, our Chicago Housing Authority, I think closer relationships with the housing authorities would be good for all of us, because they don't always take the time to know what we need. Yesterday I was in a session and somebody from a housing authority wanted to collaborate with FQHCs, and we were sharing with that person. We were, first of all, excited that she wanted to do that, because not all the housing authorities really know the impact of what we do or the importance of what we do for the residents, and they're not always readily, willing to work with us. So I think just teaching them what we do, educating them about what we do really helps. So I think that's the biggest partnership if we're going to work within public housing, with HUD, the housing authorities, and with the, they call it the something six, Hope 6. The Hope 6. I think it's really great to work with them. And all hospitals, we mentioned hospitals before, other FQHCs, and other social service agencies within the community, because together we provide better health care for the patients within or residents of public housing.